Welcome to our channel. In today's video, we'll delve into a recent study published in the journal Obstetrics and Gynecology that sheds light on the impact of COVID-19 on pregnant individuals and the prevalence of long COVID in this vulnerable population. This study, part of the National Institutes of Health's RECOVER initiative, offers crucial insights into how the virus affects pregnant people and their developing fetuses. Stay tuned as we explore the study's findings, hear from experts in the field, and discuss the broader implications for healthcare and ongoing research. Nearly 1 in 10 people infected with the coronavirus during pregnancy developed long COVID, according to a study published Thursday in the journal Obstetrics and Gynecology. This study, which underscores the consequences of the virus during pregnancy, suggests that long COVID is more prevalent among those infected while pregnant than in the general population. As many as 7% of Americans report having symptoms associated with long COVID, according to a 2022 report from the Centers for Disease Control and Prevention. Some surveys suggest a much higher incidence of long COVID in the general population. Long COVID has been a perplexing issue for researchers since the coronavirus began spreading more than 4 years ago. The syndrome is associated with a range of persistent symptoms that can vary among different patient groups. The virus can present a particular threat to pregnant individuals, who are already considered a vulnerable population. This study is a stark reminder of how pregnancy affects the immune system and highlights the need for further research. The study was funded as part of the National Institutes of Health's Researching COVID to Enhance Recovery initiative, widely known as RECOVER. I was initially surprised at the prevalence of long COVID in this population, said Tori Metz, one of the study's lead authors and a maternal-fetal medicine specialist at University of Utah Health. It really drew my attention to the fact that I need to have this on my radar when I am seeing patients. As part of the 1,500-person study, researchers analyzed individuals infected with the coronavirus during pregnancy. Half of the participants, who were mainly in their 30s, were fully vaccinated when they were enrolled. The researchers evaluated the study participants for long COVID symptoms 10 months after the initial infection. The most common symptoms reported included malaise, fatigue, and gastrointestinal issues, some of which can also be hallmark signs of pregnancy. The researchers wanted to ensure that the symptoms being reported were associated with COVID-19 rather than pregnancy or the postpartum period. They found that the effects persisted and were still evident when evaluated 10 months after the initial infection. This indicated to the researchers that the study participants' symptoms, such as fatigue and aches, were hallmarks of long COVID and not related to pregnancy. This is another opportunity to really draw attention to the fact that it's important for patients after pregnancy to continue to have ongoing care if they have chronic conditions that require specialty care and require handoffs to people who can really manage them, Metz said. Cynthia Abraham, an associate professor at Icahn School of Medicine at Mount Sinai in New York who was not involved in the study, said the research highlights the threat posed by respiratory illness during pregnancy, with the potential for worse outcomes. A lot of the data we have is from non-pregnant populations, so this paper hones in on a significant population that's been understudied, said Abraham, who is also a fellow with the American College of Obstetricians and Gynecologists. This year, more federal dollars were allocated to studying the impact of long COVID. The Biden administration announced it would invest an additional $515 million over the next 4 years to research the condition. It remains unclear how much will be spent researching pregnancy and COVID-19. So far, RECOVER has recruited more than 30,000 people, including children and those who are pregnant. Monica Longo, an OB/GYN researcher on NIH's RECOVER team and a maternal-fetal medicine expert, emphasized the importance of understanding how the disease affects pregnancy and its potential impacts on a fetus. Those 9 months are crucial for the developing fetus, and any changes in their environment can significantly alter their development, Longo said. So it is essential to examine the effects of COVID exposure on the fetus. Longo suggested that future studies could explore the consequences of the virus on the fetus and examine the implications after birth for the baby, especially regarding developmental outcomes. This study highlights the significant impact that COVID-19 can have on pregnant individuals and underscores the need for continued research and attention to this vulnerable population. As we learn more about long COVID and its effects, it is crucial for healthcare providers to be aware of these findings and ensure that patients receive the ongoing care they need. Thank you for watching, and stay tuned for more updates and insights on this important topic. If you found this video informative, please like, share, and subscribe to our channel for more content.